Opportunity for our committee to advance legislation that supports the most vulnerable Americans by reauthorizing key programs to combat substance use disorder and safeguarding seniors' access to prescription drugs. We reaffirm our commitment to strengthening our healthcare system and expanding access to care for patients and their families. Last Congress, each of the 6 bills being considered today advanced through this committee unanimously and passed the House with strong bipartisan support. Our members devoted countless hours collaborating with healthcare providers, policy experts, and patients to develop these pieces of bipartisan legislation, and I look forward to moving all of them forward once again. The Support Act for Patients and Communities Reauthorization Act, which I am co-leading with Congresswoman Pedersen, has received widespread support from over 160 vital substance use disorder treatment and recovery organizations, as well as patient-provider advocacy groups. This legislation reauthorizes key public support programs focused on prevention, treatment, and recovery for patients with substance use disorder that were established in the original Support Act, which was signed into law in 2018. Similarly, the SOAR to Health and Wellness Act, led by Representatives Carter and Cohen, will continue vital resources so local communities can help support individuals who have experienced trafficking. Another important measure, the Charlotte Woodward, wave your hand, welcome. Welcome back, I should say. You sat through the long markup the other day. We're glad to have you back and have this move forward today. So thank you for your patience and your persistence. We really appreciate you very, very much. So this has been, the bill that you're here to support is led by Representatives Kamek, Dingell, Issa, Wasserman Schultz, and ensures access to life-saving care by preventing discrimination against individuals with disabilities, including Down syndrome, with the organ transplant system. The Shandra Eisenga Act, Human Cell and Tissue Product Safety Act, led by Representatives Molinar and Dingell, will support provider and patient education and awareness, as well as strengthen standards and oversight related to tissue transplants to prevent future outbreaks and preventable tragedies. In addition, the Women in Lung Cancer Research and Preventive Service Act aims to accelerate research, improve early detection methods, and expand access to preventive services to address the rising rates of lung cancer. Lastly, the Seniors Access to Critical Medications Act, led by Representative Harshbarger and Wasserman Schultz, increases access to care by allowing Medicare beneficiaries to receive their prescriptions either by mail or by having a family member or caregiver pick up the medication on their behalf. All of these bills reflect our commitment to improving Americans' health, protecting the most vulnerable, and strengthening our healthcare system. I'm grateful today to all of my colleagues who have supported this legislation. Thank you for all your hard work, and I look forward to advancing these important bills out of committee. I will now recognize the gentleman from New Jersey, Representative Pallone, the ranking member, for 5 minutes for an opening statement. I'll yield back my time and recognize the chair.
Thank you, Mr. Chairman. Today, committee Republicans are bringing up 6 health bills that we were supposed to mark up earlier this month. Republicans continue to schedule committee markups as if these are normal times, but they're anything but normal. The daily chaos and illegal activity that we're seeing from the Trump administration is not business as usual. And yet, committee Republicans are looking to move the Support Act today, while the Trump administration is simultaneously dismantling the very agency that is responsible for supporting substance use prevention, treatment, and recovery. A few weeks ago, the Trump administration fired hundreds of staff across the Substance Abuse and Mental Health Services Administration, or SAMHSA. The administration refuses to tell us exactly how many people were fired, but we know that key senior officials, including directors of the Center for Mental Health Services, the Center for Substance Use Prevention, and the Center for Substance Abuse Treatment, were reportedly terminated. The administration is eliminating entire offices, including the offices responsible for collecting data on mental health and substance use and helping people locate treatment services. By eliminating these offices, the administration is making it harder for people seeking treatment to find care. And the Trump administration is also taking back essential funding that states rely on for mental health and substance use programs through block grants. This committee has taken a lot of bipartisan action over the last decade to combat the drug overdose crisis, but it's deeply disappointing to watch as Republicans silently stand by as the Trump administration slashes $1 billion in mental health and substance use funding. These dollars were already promised to states, and rescinding them arbitrarily will wreak havoc on their efforts to address the overdose crisis. Now, some states will not be able to fill the funding gap. Providers will go unpaid, and Americans will suffer. And yet this does not seem to matter to the Trump administration or to congressional Republicans. So let me be clear. These funding decisions will have disastrous and deadly consequences on the millions of Americans impacted by substance use disorder. And to make matters worse, a leaked internal budget proposal showed that the Trump administration intends to eliminate 8 of the programs that the Support Act reauthorizes. This includes programs to train first responders who respond to opioid overdose calls, provide residential treatment to pregnant and postpartum women, and support people in long-term recovery, among others. So again, it's Congress's job to ensure that the Department of Health and Human Services and SAMHSA can continue their critical work and that authorized programs are not being arbitrarily and illegally slashed. The Support Act reauthorizes important programs to address substance use, but it will not support, I can't, frankly, Mr. Chairman, I can't support the reauthorization of the Support Act because I have no confidence that my Republican colleagues will actually stand up to President Trump and prevent him from taking additional illegal actions that undermine the Support Act. To date, committee Republicans have not conducted any oversight of this administration, and that's a glaring dereliction of their duty, in my opinion, and it's long past time for Republicans to begin conducting the oversight necessary to ensure that these programs are faithfully implemented. Once again, congressional Republicans are showing that they're willing to overlook just about anything, including creating chaos across the federal government and decimating programs they claim to care about in order to appease this unhinged administration. Even worse, reports suggest that my Republican colleagues want to pass a bill to codify these cuts. Republicans are literally turning their backs on the American people while communities continue to battle the opioid epidemic to fund tax cuts. All this, obviously, to fund tax cuts for billionaires. And so my Republican colleagues are also moving the Support Act while simultaneously undertaking massive efforts to gut Medicaid to pay for tax breaks for billionaires and big corporations. Medicaid is the single largest payer in the country for behavioral health services, covering 40% of all Americans with opioid use disorder. The cuts being proposed will leave billions of Americans with substance use disorder without access to life-saving care, and so many other Americans doing their best to get by with very little. So I believe if my Republican colleagues want to actually support substance use disorder response efforts, they will stop all efforts to cut Medicaid. We'll see what happens, Mr. Chairman, but in any case, I can't support the reauthorization of the Support Act for all these reasons, and I yield back the balance of my time.
Thank you. The gentleman yields back, and the chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Seeing none on the Republican side, any on the Democrat side? Seeing none. Excuse me, gentleman from New York, you're recognized for 3 minutes.
Thank you, Mr. Chair. Following the firings of probationary workers at SAMHSA, I heard from about 50 SAMHSA employees who were fired and reached out to me with concern for the communities that they serve. For weeks, I reached out to the administration and still have received no answers on which divisions were impacted and how the work at SAMHSA will continue. As of this month, we have lost 50% of SAMHSA staff, and it's not HHS, and it's not the Trump administration who shared that with Congress. We only have confirmation from the press and from the former SAMHSA employees. That, I believe, is totally unacceptable. Currently, we have not received answers from HHS to key questions. How many people remain at the Office of Recovery? What about the 988 hotline? What about the Center for Mental Health Services? What about the Center for Substance Use Prevention? The Center for Substance Abuse Treatment? The regional offices? What programs have they had to cut in local communities, naloxone access, in suicide prevention? As the Energy and Commerce Committee that has jurisdiction over SAMHSA, how do we not have these answers? This affects every community in the country, and our first action should be finding out these answers. If the administration refuses to come in, then let's bring in the fired employees. These people are some of the most dedicated public servants who did this work for all of the right reasons, and they've served an incredible need. That need is even growing. On behalf of all Americans, I thank all of the fired SAMHSA employees for their service to our nation. You deserved better, and frankly, all Americans deserve better. Our loved ones should have access to effective addiction treatment, to prevention and recovery support, to behavioral health support and services. The recent actions of this Trump administration are betraying the goal of access to behavioral health treatment and support. Like everyone on this committee, I support the programs in this package. But it's completely disingenuous and frankly outrageous that Republicans are here today trying to pat themselves on the back as doing something meaningful for those struggling with addiction while the entire agency we are authoring programs for is being dismantled. The people doing the work we are authorizing have all been fired, and the administration is proposing even more draconian cuts for mental health and substance use programs in the 2026 budget. Give me a break. It's like we're trying to heal a bullet wound with a Band-Aid. So I'm regrettably going to have to vote no and would respectfully ask my Republican colleagues to pause today's markup and instead focus our attention on responding to what is an actual crisis at SAMHSA. With that, Mr. Chair, I yield back.
Thank you, and the gentleman yields back. Any Republican members, any further Democrat members speak? If the committee would indulge me for a minute, it reminded me when I saw Mr. Tonko speak. We were elected together in 2008, along with Jerry Connolly. And I just want to bring the attention, I think some of you saw that Jerry may be having to step down, and I just want to say thoughts and prayers of this committee and all of us are, what a wonderful man he is, and we're all thoughts and prayers are with him right now. So God bless him. So, having said that, I'll see no further opening statements. The chair calls up H.R. 2483 and asks the clerk to report.
H.R. 2483, a bill to reauthorize certain programs that provide for opioid.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered, and we will discuss the aims. So the chair has an amendment in the nature of a substitute at the desk, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 2483.
Without objection, the reading of the amendment is dispensed with, and the chair is recognized for 5 minutes in support of the amendment. And I want to recognize myself to speak on the aims, which makes technical changes to the underlying bill. For far too long, Americans have witnessed the unprecedented rise in drug overdoses and substance use disorders, creating an imminent need for prevention, treatment, and recovery services. The Support for Patients and Communities Reauthorization Act is long-standing priority for me and all the members of this committee, and this bill would reauthorize essential public health programs focused on prevention, treatment, and recovery for patients with substance use disorder. Last Congress, we had opportunities to hear from experts on the importance of this legislation, along with countless family members affected by substance use disorder. I remember hearing from a father who had the strength to testify before the committee about the passing of his daughter following an opioid overdose and the foundation that he and his wife established in her name. Too many of our constituents have similar stories, and these stories matter. These patients matter, and these families matter. I am very proud of the bipartisan work that went into crafting this vital legislation, which includes priorities for members on both sides of the aisle. We also received support from more than 100 advocacy organizations who use their collective voice to prioritize prevention, expand treatment options, and enhance recovery services for individuals with substance use disorder. The Senate is prepared to take action on this bill, and I am glad that our bipartisan efforts will bring much-needed support to the states, organizations, and families fighting this epidemic. Our efforts should not stop here. We should build off this momentum to continue helping families with substance use disorder and co-occurring behavioral health conditions like serious mental illness, suicidal prevention, gambling addiction, among others. Our constituents are counting on us, and I urge my colleagues to support the underlying bill and the amendment and the underlying bill. And I yield back and recognize the ranking member for 5 minutes to speak on the aims.
Thank you, Mr. Chairman. And, you know, I don't want to take away from your efforts to be bipartisan, but I'm sure you heard from both my opening statement and what Mr. Tonko said, that we cannot support moving the Support Act while the Trump administration decimates SAMHSA. I mean, literally firing hundreds of workers, leaving entire offices without staff, cutting essential funding to states for mental health and substance use services, and dismantling the agency's entire structure. So I have to ask you, Chairman, the Trump administration intends to cut many of the programs in Support Act, including the Comprehensive Opioid Recovery Centers, which is a program that you led the reauthorization for. So what are you going to do to hold the Trump administration accountable and ensure that these programs are actually funded? Otherwise, I don't see the point of moving the bill today. What are you going to do to address these concerns?
General Yield?
Yes.
So thanks for that. And these are bipartisan priorities. It's the priorities of all of us to make sure these are implemented and move forward. If the administration can present to us a way they can do it more efficiently and better, I think we're all open to government efficiency. We want to hear from them. But what I will tell you, we are going to use our oversight, because now we're talking about proposals that aren't out yet, proposals that may come out soon, but we want to make sure that we pass the legislation we need to pass, and we will have oversight to make sure it's done effectively, and if they can do it more efficiently, I support that, but we're going to make sure that these services are there. We'll have oversight of that.
Well, is that a commitment to holding a hearing and having the secretary testify as to why he's proposing these changes? I'd like that commitment from you.
Well, we do, like in every time a budget is presented, we have secretaries testify, and we have plans to do that.
Right, but I mean, that's not the same thing as holding a hearing specifically on SAMHSA. That's what I'm asking about. I mean, look, you guys on the Republican side, and constantly talk about how you want to address this. If the kinds of things that we're hearing happen, I would expect you'd have a hearing and ask the secretary to testify about these SAMHSA cuts. That's what I'm asking for.
Well, so I know that in previous hearings, you've talked about his NIH issues and other things that they had, and so we plan to have him before so we can talk about everything. You ask him questions on any of your concerns, not just SAMHSA, but we do expect him to testify.
Well, can I ask you, do you think that the president has the authority to simply cut programs or not fund programs that Congress has provided funding for, like SAMHSA? What's your view on that?
Our work is to put this into law and have oversight. If they can do it more efficiently, they can, and see their legal basis for doing it. But we will conduct oversight. One of my commitment is what we have in this bill, we want implemented and make difference in people's lives, and we'll conduct oversight to make sure that happens.
But you see, I disagree strongly with your response at this level. I do think that what the president is doing is simply cutting these programs and not funding these programs the way Congress has provided for. And I don't think that he has the authority to do that. I think we do need more accountability because the administration's actions are illegal. The courts, in most cases, have overturned a lot of their actions. And Congress, as a co-equal branch of government, has to conduct oversight over whether these actions are lawful or not, in addition to whether or not he wants to reorganize. But look, I would just urge you, Mr. Chairman, and my Republican colleagues to join us and support Democratic amendments that would address this administration's unlawful and harmful cuts to SAMHSA, which we're going to propose today, the dismantling of the agency without congressional approval and unauthorized cuts to the mental health and substance use abuse block grants and the programs reauthorize and support. All these actions by the administration, I think, are illegal. And these amendments that we're going to propose would provide much needed oversight of the Trump administration, which unfortunately, so far, my Republican colleagues are not willing to do that oversight, even as the administration, makes these changes. So again, I'm going to continue to ask for your support for what I consider a real oversight that would come from these amendments. And with that, I yield back the balance of my time, Mr. Chairman.
Thank you. The gentleman yields back. Is there further discussion? Is there further discussion? The gentlelady from Colorado recognized for 5 minutes to discuss the Ains.
Thanks, Mr. Chairman. As I said in the last time we attempted to mark up these bills, I think it's disgraceful that we're considering just one piece of the bipartisan bicameral health care package that was included in the CR last fall and then stripped out unceremoniously by Elon Musk and leaving the rest behind. When Democrats offered an opportunity to move the package in this committee on April 8th, the Republicans voted it down. And I want to speak on behalf of every dedicated advocate who has tirelessly worked on bipartisan legislation that we all care about, like the Give Kids a Chance Act, to improve the reach of the Special Diabetes Program, reauthorize the Preventing Maternal Deaths Act, and so many other bills that I haven't really been able to ascertain why we're not taking up. Now, earlier this month, the majority of this committee voted against every single one of these priorities, and I don't know why. I don't know why we just can't take the health package that this committee passed in a bipartisan way, pass it out of committee, put it on the floor. We all agreed on it. So let me talk about this bill for a minute, the Support Act reauthorization, which I and most people on this committee did support as part of the December healthcare package. I'm confused that we're working on the Support Act while the administration remotely interested in holding a hearing, conducting oversight on the reckless and unlawful activities of DOJ and of President Trump. Donald Trump, Elon Musk, and RFK Jr. have now, as Mr. Tonko said, gutted SAMHSA and hollowed out its workforce. The agency is now reduced to about half of what it was before Donald Trump took office. We don't know how many dedicated public servants the agency lost because RFK's Department of Health and Human Services, the least transparent in my 28 years in the U.S. Congress, refuses to tell us. SAMHSA had been succeeding. In President Biden's final years in office, overdose death declined by 17%. Overdose death declined by 17%. He inherited a drug crisis from Donald Trump where overdoses were increasing 31% from year to year. So now, because of DOJ and RFK Jr.'s actions, that progress seems to be reversing, and it seems to be undermining the very programs that the Support Act reauthorization seeks to do. So I don't know, it truly is fiddling while Rome burns. Why are we marking up this legislation while we're not having any desire to see if the underlying programs are actually being carried out by the administration? So it's not just the administration undermining the Support Act and its goals as at the same time as we mark up the legislation today. They're also working to cut Medicaid, which is the dominant payer for behavioral health services, including substance abuse disorder services nationwide. 35% of all Medicaid recipients have a mental illness, including substance use disorder. So when we cut Medicaid, that imperils their care. In fact, a major impediment to making substance use disorder care accessible to everybody is 10 states' refusals to expand Medicaid. So let me be clear. The Support Act is good legislation. I expect most of us will vote for it today. But while the majority is holding a bipartisan deal hostage, refuses to hold the administration accountable or provide any oversight whatsoever, and actively works to gut Medicaid, which is the backbone of substance use disorder treatment, I've got to say, we got to get back to regular order, to be true to our words, and to stand up truly in actions, not just in words, for our constituents, and I yield back.
Thank you. The gentlelady yields back, and the chair will recognize the gentlelady from Iowa, Dr. Miller Meeks, for 5 minutes to speak on the Ains.
Mr. Chairman, I move to strike the last word. Thank you, Mr. Chairman. I'm proud to see the Energy and Commerce Committee marking up the Support Act, which has had tremendous impact on opioid and mental health epidemic in America. And let me also say that the number of overdose deaths reached their zenith under the Biden administration. And in fact, let's be true to our words and stop saying things like, some people are trying to gut Medicaid, which we know is not happening and is not true and is a myth. So having said that, I'd like to highlight a bipartisan initiative I've been working on for 2 years to complement this bill's efforts. According to the CDC, we lost more than 110,000 Americans to drug overdose deaths in 2022. It's estimated that 75% of these deaths involved opioids, meaning that 226 Americans died every day to opioids. While many cases of drug-related deaths are poisoning, where the individual does not know that the product they're about to use is laced with another substance like fentanyl or synthetic fentanyl, More needs to be done to prevent addiction, including minimizing unnecessary exposure to opioids. 90% of acute pain patients receive opioids to manage their pain, whether or not they need them. Between 2011 and 2019, opioid prescriptions decreased by 40% from approximately 250 million to 150 million prescriptions dispensed. This is true across most payer audiences, Medicaid, private, and cash payments. However, among Medicare patients, opioid prescribing has actually increased. Furthermore, Medicare's share of opioid prescribing during this time has increased substantially from approximately 20% of the country's opioid prescriptions in 2011 to 35% in 2019. This represents a 75% increase in just under a decade. We clearly have work to do in Medicare to make sure that patients have access to effective pain relief agents while also not unnecessarily exposing them to narcotic painkillers. One way to do this would be to increase access to non-opioid pain management medications or other entities, which I'm seeking to accomplish with my legislation, the Alternatives to Pain Act. This legislation, which I thank Congresswoman Berrigan for co-leading, would decrease barriers to accessing non-opioid pain management alternatives that are FDA approved. I ask that the chair commit to working with me on this legislation to continue the great opioid use reduction work this committee has accomplished. I fully support the Support Act, and thank you, Mr. Chair. I yield back.
Would the gentlelady yield?
I'll yield.
I thank the gentlelady for yielding. Thank you, Mr. Chairman. I wish to add my support for this important legislation before the subcommittee today. The Support for Patients and Communities Act is a comprehensive and bipartisan piece of legislation that provides support and builds on previous success. This legislation also includes a provision that mirrors the Mental Health Improvement Act, which I co-introduced with Representative Sykes last Congress, reauthorizing Section 756F of the Public Health Service Act, which provides important grant funding for our behavioral health force. Investments like these in workforce development are crucial as communities across our country work to tackle the scourge of addiction and the devastation that it leaves behind in its wake. We worked extensively on this bill last Congress, including when this subcommittee went to Gettysburg, Pennsylvania, where we heard powerful and important testimony from my constituents. And I would again like to thank Mike Strawley, Chief Saravola, and Dr. Crawford for their input and for sharing their firsthand knowledge and experiences with opioids and with the addiction crisis that we are currently facing. We must continue this important work now by passing this bill through committee and getting it to President Trump for his signature into law. I urge the support of this bill, and I yield back to the gentlelady.
Thank you, Mr. Chair. I yield back.
Gentlelady yields back. Is there anyone seeking further discussion? Gentlelady from New York, Ms. Clark, you're recognized for 5 minutes to discuss the aims.
Thank you very much, Mr. Chairman. I move to strike the last word. The leaders of this committee, along with a bicameral group of congressional leaders, negotiated a bipartisan end-of-year package which would have included this common sense legislation as well as a number of other bills being considered at today's markup. Members of both parties were ready and willing to pass this package of bills, most of which went through the regular order in December of 2024. However, I am perplexed that we're even in a position to take these bills up today. Bills that should have been passed by both chambers of Congress and signed into law at the end of last year. Unfortunately, our colleagues across the aisle, whether due to fear or blind fealty, killed the bipartisan bill negotiated by the leaders of this committee and many others on the orders of one man, Elon Musk. One tweet from the world's richest man and Donald Trump's biggest financial supporter, and Republicans shriveled up right up and meekly allowed a weaker bill to pass. And now, we are expected to sit here today and pretend everything is normal. It's not. It is not. Republicans want to use markups like this one to show the American people they are addressing the opioid epidemic and fighting to protect access to quality, affordable health care, but won't say a word about the nonsensicals at the Department of Health and Human Services. We can no longer sit back, excuse me, and trade support for each other's bills, let House GOP leadership use that bipartisan support to fill up the suspension calendar with only Republican bills, and then simply hope that Elon Musk or whichever billionaire is calling the shots for Republican leadership on a given day will deem to permit Democratic bills to move forward. I'm done waiting on Republican leadership to magically grow the backbone they've been lacking since Donald Trump rose to power. I'm done letting my support for common sense legislation at the committee level be used as cover to advance Republican priorities while Democratic bills and priorities are routinely ignored and subject to the whims of the oligarch class. We can no longer act like it is business as usual here in Washington, D.C. That time is over. We are in a crisis, and it's past time we start acting like it. Which is why, even though I support these bills, I will be voting no. This time has come. The time has come to put an end to the business as usual approach we have taken to this point. And with that, Mr. Chairman, thank you, and I yield back the balance of my time.
The gentlelady yields back. Anyone seeking further discussion? The gentleman from California, Mr. Obernolte, is recognized for 5 minutes.
Mr. Chairman, I move to strike the last word and speak in
Gentleman is
support of the bill.
recognized.
Mr. Chairman, I rise in strong support of the Support Act. This is a bipartisan bill that contains many of the policy priorities that have been passed by this committee over the last 12 months, and I'd like to thank you for including my bill, the 988 Lifeline Cybersecurity Responsibility Act, in this package. As I think everyone on the dais here knows, the 988 Lifeline has saved unquestionably thousands of lives since it's been instituted. It's fielded over 10 million calls in its short lifetime. And yet, that lifeline has been taken down recently by a cybersecurity attack. This provision in the bill would shore up the cybersecurity of the lifeline by improving coordination and communication between various reporting entities. This is a common sense piece of legislation, and I'd like to thank you for including it. And just to make the point, this is most of the bills we're considering today are bipartisan, they're common sense. Folks, this is not a referendum on one's support for the Trump administration. I've served on this committee in the majority and the minority in the White House, and I think we need to focus on voting on the policy and focus on the things we can agree on. And it really hurts my heart to see some of the bickering that's going on here, and I wish we would just be able to focus on the things we can accomplish together. With that, I yield back.
The gentleman yields back. Anyone seeking further discussion? Gentleman from New Jersey, Mr. Menendez, is recognized for 5 minutes to speak on the Ains.
Thank you, Chairman, and I want to join the ranking member and so many of my colleagues on the Democratic side of the aisle who agree we want to work on issues together in a bipartisan way. But what's challenging for us is the silence and the refusal to demonstrate the harm that this administration is causing with respect to HHS, with respect to the restructuring and limiting of SAMHSA. And it's almost like living in dual realities, right? Where you can see what this administration is doing and not say a word. And then come to committee and say we should do things on a bipartisan basis, but that would be sending more legislation to the administration to be chopped up and disregarded. And that's what we find so challenging in this moment is there were a whole host of bills, as other members have spoken to, that were agreed to on a bipartisan basis that because one person objected to, we walked away from. And now we're back with only one bill from that health package. And we just want to know why, and why we can't work together again on that full set of bills, and why we have to be stuck with just one bill that we're worried this administration won't implement. And that's a challenging moment that we're in, and I think we would just like to see our colleagues across the aisle join us to call out the harm that this administration is doing to so many bipartisan things that have already been passed into law, because I think that's what the American people really want us to do. And when I was home for the last 2 weeks, that was the clear message that was sent to me, and I just wish our friends across the aisle heard it as well. And with that, I yield back.
Gentleman yields back. Any further discussion on the Republican side? Seeing none, any further discussion on the Democrat side? Seeing none, are there any amendments? Gentleman from New Jersey, who's recognized? Does Mr. Tonko, what person is the gentleman from New York seek recognition?
Mr. Chair, I have an amendment at the desk.
Gentleman is recognized.
Thank you, Mr. Chair. As a committee, we have worked together hand in hand on a bipartisan basis to pass the Support Act. And I
I'm
believe
sorry, Mr. Tonko, would you call up the amendment? We need to,
it is AMD 01 XML.
And Mr. Chairman, may I reserve a point of order at this time?
Point of order is, gentleman
Reserved.
reserves a point of order. Do you describe the amendment so we can? You have the amendment? You report the amendment?
Amendment to the amendment in the nature of a substitute to H.R. 2483, offered by Mr. Tonko. At the end of the
Without
bill,
objection, the amendment, reading of the amendment is dispensed with. We want to make sure we got which amendment. What number amendment do you have?
2020, or AMD 01 XML.
Okay. Without objection, the reading amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chair. As a committee, we have worked together hand in hand on a bipartisan basis to pass the Support Act. And I do believe we all understand the importance of SAMHSA to our nation's overdose crisis, as well as the behavioral health crisis. The expertise and funding that flows through SAMHSA are life-saving. Every community in this nation has experienced the overdose crisis and the mental health crisis. Every member should know the value of SAMHSA to their district in terms of lives saved. Every state has SAMHSA funding that supports the response to these crises. In New York, in Georgia, in Kentucky, in every state, our communities benefit from this funding, whether it's training providers on evidence-based addiction medical treatment, or providing life-saving naloxone, or launching prevention or recovery efforts, or supporting 988, we get it. SAMHSA is working to save lives. I think everyone in this room likes what SAMHSA does, which is why I'm baffled. Why are we allowing SAMHSA to be decimated? Why are we sitting here discussing anything else other than how do we stop the gutting of SAMHSA? 50% of staff at SAMHSA were just fired. $1 billion of life-saving funding was just yanked away from states. The administration has said that this funding was terminated due to its connection to the COVID-19 pandemic. But nothing in the law limits these dollars to COVID purposes, or for only during a public health emergency. Congress recognized that the impacts of the pandemic would reach well beyond an emergency period and chose not to condition the funding on whether there was an active public health emergency in place. So the administration's decision to terminate these grants goes against congressional intent and is wreaking havoc on state and local opioid response efforts. This was funding that Congress approved and wanted to be used for the overdose and behavioral health. By revoking the availability of these funds, the money remaining will be returned to the Treasury and will not necessarily be reinvested into actions to address the addiction and behavioral crisis. This is tragic. We need to ensure that the Trump administration reverses course on this immediately. Everyone in this room should be demanding that this recklessness be stopped, and stopped today. States need more time to allocate these resources given the important need. These are critical funds supporting mental health, addiction prevention, treatment, and recovery. These funds can and should be fully invested in a systematic way. The pandemic caused massive trauma to many Americans of all ages for many different reasons. While the pandemic may be over, the mental health and addiction reverberations are not. These funds are crucial for states and communities in continuing to care for these Americans. We need to finish the job or real impacts will be felt. In New York State alone, more than 350 organizations across the state are impacted by the canceled health grant funding. For SAMHSA in particular, this funding directly supported mental health treatment providers, SUD treatment providers, crisis centers, and 988 call centers. Among just 32 organizations that responded to a survey in New York, 8,200 New Yorkers will lose access to care as a result of the early COVID-19 grant cuts. Let's remember that 350 organizations were impacted by the full health cuts in New York State, so that the loss of services and access is even wider. Several organizations have already reported suspending or shutting down programs, many of which are critical lifelines for individuals in treatment. These disruptions threaten to derail recovery, worsen health outcomes, and in some cases may even be life-threatening. Reports of staff layoffs have also begun to surface. In my district, I recently heard that the Troy Drug-Free Community Coalition was notified that they lost their funding and that obligated grant funds have been terminated effective immediately, and that any further expenditures related to these contracts will not be reimbursable. Do we really want to cut off funding for drug-free communities? In New York, organizations have overwhelmingly stated that the early termination of federal COVID grants would lead to significant cuts, starting with prevention services. Outpatient programs, including medication-assisted treatment and on-track, along with residential and crisis stabilization services, are also at risk. Do we really want to cut funding from MAT, for MAT? What about residential and crisis stabilization services? Do we want to cut funding for existing recovery community services, such as recovery community centers and youth clubhouses? Do we want to cut funding for transitional housing to help provide short-term housing and case management for individuals leaving residential treatment or correctional facilities who cannot otherwise access permanent housing? Do we want to cut care coordination and the provision of transportation assistance to ensure access to treatment, recovery, and other basic services? Do we want to cut these programs? I don't think so. Because of all of these all these cuts being made, the nation is getting impacted because of these clawbacks. When do we come together on a bipartisan basis and say, enough, this is not acceptable? We should be ashamed that as a committee, we have not all come together to demand that these senseless cuts immediately be restored. I ask all of my colleagues to support my amendment to restore the state's ability to access this life-saving funding so it can reach our communities as intended by Congress. If we want to call it a crisis, let us act accordingly. With that, I yield back.
Gentleman yields back, and the chair recognizes the gentleman from Georgia, Mr. Carter, for 5 minutes. Oh, gentleman, Mr. Griffin? Okay. Gentleman from Virginia is recognized for 5 minutes.
Thank you, Mr. Chairman. I find this amendment kind of interesting. I'm sitting here looking at the language, and as it reads, and I look for my colleague to tell me if I'm reading it wrong, as it reads, all of these good things in the Support Act won't come into play unless the president in the administrative branch of government takes action to release other funds. So as I understand it, because we don't like the cutting of funds or the withholding of programs by the administration, and I'm not saying that's accurate, I'm just saying that's what is purported, we're going to refuse to allow the Support Act to go forward unless we agree we're giving the Secretary this power. Why would we give the Secretary the power to do exactly what he wants to do and then gut another program that it is Congress's will, I believe, to have become law? This just seems to me to be illogical, Mr. Chairman, that we would give the Secretary the power to gut a congressional intent. It's one of my concerns in Congress in general that over the last decades, long before any of us got here, started, we keep giving the Secretary the power to do this or the Secretary to make this determination or to do that. And whenever you do it, whichever party's in control of the White House gets to say what they want done and what they don't want done. Seems to me we ought to make these congressional actions. And so I can't support this amendment just from a basic philosophical standpoint that we're giving the Secretary not only the power over this bill, but encouraging them to not pass or not to deal with our bill because they can control the life of the Support Act by refusing to do what the gentleman wants them to do. So it seems to me to be illogical.
Will the gentleman yield?
I will yield, because if I read it wrong, I invite her to tell me.
So some of us are a little confused about what you're saying, and because we also agree that if Congress says that the administration should do something in legislation, then they should do it. So would you agree with Mr. Pallone's suggestion that we do oversight to see if, in fact, the Secretary of HHS has overstepped his authority by rescinding some of these programs and expenditures that Congress has made?
It's interesting you asked that question, because when Mr. Pallone was making the point, I thought about last year when the White House was controlled by a different party. And to his credit, the then Secretary of HHS, when I raised concerns in our regular hearing, and the chairman said we're going to have our regular hearing with the Secretary, as we normally do on budget, et cetera, where you can talk about all kinds of things, I brought up a problem I was very concerned with OOR, as you will recall.
Yeah. And
he agreed to come to a special oversight meeting while he was here in that regular meeting. So I think step one is to have our regular meeting with the Secretary, as we would with any administration, and then we can ask that administration representative, in this case the Secretary of HHS, to come back for an oversight hearing. I hope he will agree to that. I think that's appropriate, and I think we should conduct oversight over all agencies within our jurisdiction.
If I may, I sent a letter along with all the other Democrats on the Health Subcommittee back in January asking the Secretary to meet with us. And then we made an effort to get him to meet with us again before this last recess, and we've heard zero back. So if you can help us if you can help to ensure we get this meeting soon, and I say this in all, as you know, Mr. Griffith, I say this in all honesty and nonpartisanship, is I'm really worried about these cuts, particularly at NIH, FDA, CDC, but also like with the Support Act and SAMHSA. I'm worried about those. So the sooner we can get the secretary in here, I think the better it would be for the health of our Americans. So I appreciate you indulging.
And I would say to the gentlewoman that we need to look in the mirror, and we need to look across time and stop giving so much power to the executive branch by allowing secretary to do this or the secretary to do that. That's where we get into problems. And just as I was frustrated when there was a Democrat administration because they wouldn't answer my questions, and because as we give this power away, we don't have the ability to call these people in as much because we've given the power away.
Amen.
And unfortunately, this amendment gives more power to the secretary. I know it wasn't the intent of the sponsor of the amendment, but that's what it does. And I just think as a body, not looking at R's and D's, but as a body, we need to stop giving so much power to any executive branch, no matter who is in the White House. I yield
Amen.
back.
Thank you.
Gentleman yields back. The chair recognizes a gentleman from New Jersey for 5 minutes, Mr. Plum, Ranking Member Plum.
Thank you, Mr. Chairman. I support Mr. Tonko's amendment because I think it's necessary given all the things that the Democrats have already discussed today. I mean, I appreciate the gentleman's from Virginia's comments, but I don't think it matters. Look, you know, the bottom line is the secretaries don't have authority to do anything. I mean, the decision to cut, to freeze the funds that are already obligated, decisions to fire people, these are all being made by Elon Musk, right? He comes in with Doge, he tells them what to do. Who knows if RFK even knows what's going on there? He's just dictated to by Elon Musk, in my opinion. But, you know, I appreciate your comments, but I don't think it really matters. What really matters here is what Mr. Tonko is trying to do. We know that we've had these obligated funds that were going to go to the states, the block grants. They were illegally frozen. Funds are obligated. You don't have the right to say that, take them back once they're obligated. It's a contract, okay? So again, this gets into the whole issue of what's happening here and what's legal and what isn't, which is why we need an oversight hearing. The same thing with rational. You know, the chairman, Guthrie, said, well, maybe some of these things have some rational basis. Well, I don't know how anything can, you know, how cutting a block grant to states and then, you know, not spending the money on SAMHSA and treatment has any rational basis or has any reorganization nature that's actually going to help people that have substance abuse disorders. But again, if you believe that, which I don't, but if you do, then you should have a hearing. We should have a hearing on whether or not these taken back obligated funds is legal or not, whether or not there's any rational basis for cutting the funds and firing people. That's why we need a hearing. And I don't hear anything coming from the chair or from the gentleman for Virginia specifically saying that we're going to have this hearing. A budget hearing is one thing. You might be able to ask a question, maybe, but we really need a hearing on this issue. And drag the secretary in here and make him explain what the rationale is. He doesn't explain the rationale. He just says, we're doing it because Doge tells him he has to. He doesn't give any reason. I've never heard any reason from him about any of these cuts at HHS. But in any case, I yield back, Mr. Chairman.
Gentleman yields back. The chair recognizes a gentleman from Georgia, Mr. Carter, for 5 minutes.
Mr. Chairman, I rise in opposition to this amendment, and you know, I appreciate my colleagues' interest in supporting individuals with substance use disorder and mental health conditions, but this amendment would unnecessarily delay the implementation of this critical bill, a bill that I think it's worth noting was garnered wide bipartisan support just last Congress. In fact, unanimous from this committee. Unanimous from this committee, and it's currently being supported by over 160 stakeholder organizations. The funding that's in question from the American Rescue Plan Act, that was appropriated over 4 years ago. Over 4 years ago, and we need to be focused on targeting spending to address our nation's problems, and it's clear that the excess spending from the American Rescue Plan Act was too much to actually be spent in a meaningful fashion. On the other hand, the approach taken by the original Support Act and this reauthorization is targeted to meet programmatic needs. My colleagues on the other side of the aisle have talked a lot about not getting this critical bill done in December, but now want to add an unnecessary administrative delay? I don't get it. I don't understand that. We should reject this amendment, which would unnecessarily prevent much-needed resources from reaching our communities. I urge my colleagues to oppose this amendment, and I yield back.
Gentleman yields back. Any further discussion on the amendment? Okay. Any further? Seeing none, the question now occurs on the amendment. A roll call vote has been requested, and the clerk will call the roll.
Mr. Lauda? No. Mr. Lauda votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Pfluger? Ms. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mrs. Houchin? Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Rulli? Mr. Evans? Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Ms. Castor? Mr. Tonko?
Aye.
Mr. Tonker votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Badagan? Ms. Badagan votes aye. Mr. Soto? Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie?
No?
Chairman Guthrie votes no.
How is Dr. Dunn recorded?
Dr. Dunn is not recorded.
How's
Dr.
the
Dunn
gentleman
votes
from Texas
no.
record? Mr. Crenshaw?
Mr. Crenshaw votes no.
Mr. Allen?
Mr. Allen votes no.
Mr. Fulker?
Mr. Fulcher votes no.
Dr. Miller-Meeks?
Dr. Miller-Meeks votes no.
Ms. Fedorchak?
Ms. Fedorchak votes no.
Mr. Soto?
Mr. Soto is not recorded. Mr. Soto votes aye.
Is there anyone seeking to answer the roll call? Clerk, shall I report?
Chairman Guthrie, on that vote, there were 20 ayes and 24 noes.
The amendment is not agreed to. Will the clerk, are there any further amendments? What purpose, the gentlelady from Massachusetts?
Thank you, Mr. Chairman. I have an amendment at the desk titled Trahan 009.
The clerk will report.
And Mr. Chairman, if I could reserve a point of order.
Point of order is reserved. Clerk will report.
Amendment to the amendment in the nature of a substitute to H.R. 2483, offered by Ms. Trahan of Massachusetts.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Massachusetts is recognized for 5 minutes in support of her amendment.
After years of relentless escalation, we're finally seeing the first signs of progress in reducing overdose deaths. That's welcome news, but let's be clear about why it's happening. Many public health experts agree that this decline is largely due to the increased availability of naloxone or Narcan. It's not because the crisis has ended. It's because we've made it easier for people to access the tools that can reverse an overdose in real time. That's why my amendment is so important. It makes clear that no restructuring of HHS and no reduction in FDA staffing should be allowed to delay, disrupt, or defund the FDA's work on overdose reversal and treatment. It protects the research, the review, and the approval of new formulations of naloxone, whether they're over-the-counter, long-acting, or faster-acting. It safeguards access to medications for opioid use disorder, and it preserves the FDA's ability to carry out the oversight and regulatory work that ensures these treatments are safe, effective, and available when people need them. This is not theoretical. We are watching this administration push forward a reorganization of HHS with zero hearings, zero transparency, and no clear plan to protect essential public health work. Meanwhile, critical positions at the FDA, positions that support efforts to combat opioid addiction, are being eliminated or left vacant. We simply cannot afford to backslide at this moment. This amendment doesn't tie the administration's hands. It doesn't block reform. It just demands accountability. It says if you're going to make structural changes that affect the FDA, you need to certify that those changes won't slow down approvals for overdose treatments, won't drain resources from addiction treatment review, and won't undermine public health strategies that are finally saving lives. Over the past few years, we've seen a troubling uptick in illicit fentanyl laced with xylazine, a combination that today's Narcan simply cannot reverse. This highlights the urgent need for future iterations of Narcan and medication to treat opioid use disorder to be effective against the unknown substances flooding our drug supply. We need to be able to respond quickly to these evolving threats, but gutting our regulatory agencies like the FDA will make that impossible. If we reduce FDA's capacity to swiftly approve new treatments or maintain rigorous oversight, we risk reversing the hard-won progress we've made in addressing this crisis, and we cannot afford to take steps backward when lives are on the line. As policymakers, it's our responsibility to ensure that the FDA and other regulatory bodies can continue their vital work without being undermined by arbitrary cuts or reorganization. Now, everyone on this committee should be committed to protecting the tools and resources necessary to save lives and address the opioid crisis head-on. So I urge my colleagues to support this amendment so we can preserve our ability to respond effectively to the evolving challenges that we face. Thank you. I yield back.
Gentlelady yields back, and the chair recognizes gentleman from Georgia, Mr. Carter, for 5 minutes to speak on the amendment.
Mr. Chairman, as we all know, the Support Act for Patients and Communities Reauthorization Act of 2025 continues critical support for individuals battling addiction and marks a significant step forward in addressing the national opioid epidemic, something that we all agree on, something we all understand needs to be done. That's why I'm having trouble understanding. Again, this amendment would unnecessarily delay the implementation of this critical bill. Why would we want to do that? Just as I asked on the last bill. I support access to life-saving overdose reversal medications, as we all do. I don't think there's any question about that. In fact, many provisions included in the Support Act continue resources for states, first responders, treatment providers, and community organizations to access and administer opioid overdose reversal medications. My colleagues on the other side of the aisle have talked a lot about not getting this done in December, which I understand. But now they want to add an unnecessary administrative delay. I don't understand that. We should reject this amendment, which would prevent much-needed resources from reaching our communities. I urge my colleagues to oppose this amendment, and I yield back.
The gentleman yields back. Is there any further discussion on the amendment? Roll call. Seeing none, no further discussion. The vote occurs on the amendment. There's a roll call vote requested, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fluger? Mrs. Harshbarger? Ms. Harshbarger votes no. Ms. Miller-Meeks? Ms. Miller-Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. James? Mr. James votes no. Mr. Bentz? Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Rulli? Mr. Evans? Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Ms. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Ms. Castor? Aye. Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mr. Veazey? Ms. Kelly? Ms. Kelly votes aye. Ms. Badagan? Ms. Badagan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no.
Mr. Clerk, how is Dr. Dunn recorded?
Dr. Dunn is not recorded.
Mr. Crenshaw?
Dr. Dunn votes no.
Mr. Crenshaw?
Mr. Crenshaw votes no.
Mr. Allen?
Mr. Allen votes no.
Mr. Obernolte?
Mr. Obernolte votes no.
Mr. Fulcher?
Mr. Fulcher votes no.
Mr. Vesey?
Mr. Veazey is not recorded. Mr. Veazey votes aye.
Is there any others seeking the roll call? The clerk will report.
Mr. Chairman, on that vote, there were 21 ayes and 25 noes.
The amendment is not agreed to. Are there further amendments? Are there any further amendments? Oh, who do you have next? Gentlelady from Florida? Gentlelady, Ms. Kester? You have, okay, I'm sorry. Okay, Ms. Kelly. I thought you said Kester. Okay, I'm sorry. I knew which one. I was just pointing to the wrong one. Gentlelady from Illinois, Ms. Kelly, you're recognized. What purpose is gentlelady from Illinois seek recognition?
I have an amendment at the desk.
Clerk will report.
Mr. Chairman, could the gentlelady please specify the amendment?
Sure. It's H2483 underscore support 2025 at FCD AMD underscore 11 underscore XML.
And, Mr. Chairman, if I could reserve a point of order.
Order has been reserved by the gentleman from Virginia. Clerk will report.
Amendment to the amendment in the nature of a substitute to HR 2483, offered by Ms. Kelly.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chair. My amendment makes clarifying changes to the underlying bill to put a stop to Elon Musk's Department of Government efficiency from unlawfully restructuring HHS and its vital agencies. These are far from normal times. We're now meeting a third time on healthcare bills that should have advanced months ago under an agreement reached by this committee and leadership last year. We cannot allow some to push forward a reckless and illegal plan to dismantle essential public health agencies without congressional input. Despite these repeated attempts, they've yet to offer a coherent path forward. Their most current attempt, which was leaked, details their sweeping and unauthorized reauthorization of HHS, including the elimination of multiple key programs under the Support Act and reckless reduction in force of personnel, none of which were previously reviewed or approved by Congress. The reorganization plans put forward by the Trump administration without proper due process and an astonishing lack of transparency have raised significant concerns about the stability and effectiveness of the agencies tasked with protecting the health and well-being of Americans. The proposed changes that include illegally eliminating the total number of public service jobs to 20,000 or cutting about 25% of employees threatens to destabilize these essential functions at a time when they are most needed. This amendment does not oppose modernization, but demands thoughtful reorganization with clear oversight. Congress has a duty to hold the Trump administration accountable, particularly when proposals like dismantling SAMHSA threaten to deepen the ongoing mental health and substance use crises. Eliminating the directors of critical agencies such as the Center for Mental Health Services, the Center for Substance Abuse Prevention, and the Office of Minority Health would jeopardize vital services, reduce expert guidance, and slow coordination across programs. These cuts represent just a fraction of the broader risk posed by the proposed overhaul. And now, under the guise of cutting waste, fraud, and abuse, the shutdown of regional offices like San Francisco, Boston, New York, Seattle, and our very own Region 5 in Chicago. They all have something in common. These closures would cause major disruptions, delays, and a sharp decline in essential services. I want to thank the staff of Ranking Member Pallone for working with me on this language. I also urge my colleagues, particularly my Republican colleagues, to join in the call for greater accountability for this administration. The American people deserve a government that works without compromising essential services in the pursuit of a misguided agenda. This amendment is a step toward that goal. As chair of the Congressional Black Caucus Health Brain Trust, I will continue to work on course correcting the harmful impacts of these reckless decisions and ensure that health equity is at the center of federal health policy. Thank you, and I yield back.
Gentlelady yields back. The gentleman from Georgia, seek recognition to speak on the amendment.
Mr. Chairman, I speak in opposition to this amendment, and I truly am confused here. This amendment would unnecessarily delay the implementation of this critical bill, which everyone seems to agree should have been implemented earlier, should have been implemented last year. I'm not understanding why we're delaying these things here. It's my understanding that many of the programs outlined in the amendment have not been impacted by the HHS reduction in force. This amendment would simply result in delaying the allocation of important resources for prevention, treatment, and recovery for individuals suffering from substance use disorder. I don't think anyone on this committee wants to see that happen. These patients deserve our help, and getting the Support for Patients and Communities Reauthorization Act signed into law is one way we can assist these individuals and families. That's why I urge my colleagues to oppose this amendment. And I yield.
Gentleman yield to me?
Yes, I yield.
I just want to say real quick, I've been kind of rattled today on the news of Jerry, and so I texted him to let him know we're all praying for him. And my last text to him, laughter through tears is the best emotion, they always say, but last time I texted him was Valentine's Day, I noticed, to warn him about getting a Valentine's gift for his wife, because the year before, he had forgotten to the last minute. His staff said, you got something for Smitty. Everybody knows Smitty. She's a wonderful lady. Takes a beautiful box that somebody had given him, wrapped it up, gives it to his wife. She opens it up and says, thanks for the Valentine's gift. Was this a re-gift? And only Jerry could tell it, the way Jerry's drama, as we know. He's like, oh, of course not. You know, I love you. I would never do that to you. And she says, well, why do the cookies say a Matsui Valentine? So he re-gifted Doris's cookies. And he said, well, Doris put her name on the cookies. Why would she do that? So anyway, he was out. So anyway, so that's, so I'm sorry. I'm a little rattled on Jerry, but let's keep him in our prayers. I'll yield back to the gentleman from Georgia.
I yield.
Yeah, gentleman yields back. Any further discussion on the amendment? Mr. Tonko, we're elected together with Jerry, so Mr.
That's
Tonko,
right.
you recognize.
It's quite the
speak on
class,
amendment.
too.
Yeah.
Yeah, thank you, Mr. Chair. I move to strike the last word. Thank you. Since day one, this administration has launched a relentless assault on the very programs that states depend on to keep our communities running. This isn't streamlining government. It's sabotaging the systems that support everyday Americans. We're watching a slow-motion demolition of our government's ability to serve the American people. And if we don't stop it now, we'll all pay the price in delayed benefits, weakened security, and crippled services. AHA is no exception to this reckless mentality. The whole reason Congress moved SAMHSA into an independent agency was to ensure that behavioral health was prioritized despite the long-standing stigma. Instead, AHA would take us back to the time that behavioral health is tucked away in another agency and deprioritized. The firing of 50% of SAMHSA staff, which means a huge loss in capacity and expertise, coupled with the looming budget cuts, makes clear that behavioral health is not a priority for this administration. I beg my colleagues on the other side of the aisle, let's reverse course. We have reauthorized SAMHSA through this very committee multiple times with bipartisan support. We have an obligation to protect SAMHSA's mission and all of our constituents who SAMHSA serves. I urge everyone to do the right thing and support this amendment. Folks are counting on us doing the right thing, the compassionate thing, the sensible thing. With that, I yield back.
Gentleman yields back. Anyone else seek recognition? Seeing none, we shall vote on the amendment, and a roll call has been requested.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw, Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Pfluger. Mr. Fulcher votes no. Mr. Pfluger. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Miller Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. James. Mr. James votes no. Mr. Bentz. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Mrs. Lee. Mrs. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Evans.
Self-interest.
Mr. Goldman. Mr. Goldman votes no. Ms. Fedorchak. Ms. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mr. Veazey. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
How's Mr. Hudson recorded?
Mr. Hudson's not recorded. Mr. Hudson votes no.
How's Mr. Dunn recorded?
Mr. Dunn is not recorded. Mr. Dunn votes no.
How is Mr. Joyce recorded?
Mr. Joyce is recorded as no.
Mr. Vesey? How's Mr. Vesey recorded?
Mr. Veazey is not recorded. Mr. Veazey votes aye.
How is Mr. Obernolte recorded?
Mr. Obernolte votes no.
Mr. Crenshaw?
Mr. Crenshaw is not recorded. Mr. Crenshaw votes no.
Anybody else? All right. The clerk will report the roll call.
Mr. Chairman, on that vote, there were 22 ayes and 26 noes.
Could you repeat that, please?
Yes, sir. There were 21 ayes and 26 noes.
Noes have it, the amendment is not agreed to. I now recognize Ms. Castor for the purposes of presenting an amendment.
Well, thank you, Mr. Chairman. Mr. Chairman, I'm going to call this the whistling past the graveyard amendment. The first 100 days of the Trump administration have been extremely costly.
Ms. Castor?
I
You
will
need to call
call
the
up
amendment up
the
first.
whistling past the graveyard amendment, please. It's support 2025 Fed Amendment 14.
Amendment to the amendment in the nature of a substitute to 2483 offered by Ms. Castor.
And a reservation on a point of order is recognized and will be held by me. Ms. Castor?
Well, thank
You're
you.
recognized to speak on your amendment.
Thank you, Mr. Chairman. Again, I'm going to title this the Whistling Past the Graveyard Amendment, because that's what's happening with our Republican colleagues today on a very important topic. The first 100 days of the Trump administration have been so costly and chaotic. We've watched Elon Musk take a chainsaw to so much of what makes America great, and that includes all of our progress on bolstering Americans' health, everything across the health enterprise, scientific research, longtime health experts that have devoted their lives to public service and finding treatments and cures have been unceremoniously fired without any reason at all. Congressional directed funding has been illegally frozen. Those are dollars that go to our research institutes, postdocs, people trying to find the cures for cancer, Alzheimer's, ALS, or more. Did you all know that they have, in many places, frozen clinical trials? That's going to cost lives. Inspectors general were fired. They're the ones who help root out waste, fraud, and abuse. Personal data and information is being inappropriately accessed. They're doing great harm to everything we do to help people save money and protect their health and protect the public health. And now the president and the Republicans are charging ahead with their plan to make America more expensive and less healthy. But it gets worse, because 2 weeks ago, the HHS Secretary, Kennedy, proposed a budget for Health and Human Services. If you haven't seen it, it's a 64-page document that is simply a gut punch to patients, to researchers, to providers, and families all across America. It is a breathtaking betrayal of everything that we have worked on in this committee to build to keep Americans healthy and well. Cancer research, Alzheimer's, ALS, and mental health and substance use disorders. Particularly important to today's debate, their budget proposes eliminating the experts and initiatives at the Substance Abuse and Mental Health Services Administration, SAMHSA. Instead of funding proven initiatives built by this committee and partners and experts all across America over decades to battle America's opioid epidemic, overdose and suicide crisis, mental health emergencies, the President and Republicans have different priorities. That their priority is to make sure that billionaires get a tax cut, that the wealthy and the well-connected get more and more and more. The Medicaid people, our neighbors who we love the most, who rely on Medicaid, they're on their own. But the billionaires, maybe they'll have another yacht or another special place for their vacation. Okay, so in this budget specifically, here's what they propose to eliminate. Training for first responders, youth prevention and recovery efforts, residential treatment programs for pregnant and postpartum women, comprehensive opioid recovery centers, peer support and community-based initiatives, evidence-based research into trauma-informed care, and grants to help individuals living with substance use disorders live independently and participate in the workplace. This is incredibly costly. It really is a betrayal of so much of the progress that we have made for patients, especially that grapple with behavioral health needs. And for what? To scrape together every penny to be found to give massive tax breaks and giveaways to billionaires. So my amendment is simple. It says this version of the Support Act could not go into effect until the Trump administration and Republicans in Congress halt all of the damage that they are doing to our health enterprise. Because this committee does not operate in a vacuum. As much as the Support Act needs to be reauthorized, how do my Republican colleagues expect it to work under proposals where no one will be home to actually do that work? You're whistling past the graveyard in more ways than one. I urge my colleagues to join me and support this amendment, and I yield back.
Gentlelady yields back. Recognize gentleman from Alabama. No.
Thank you.
Yeah.
It's interesting. I reserved the last word. Strike the last word. It's interesting.
And what would that word be? Just teasing.
Well, I was
Gentlemen, may proceed.
I was concerned that you didn't know who it was there for a moment, but kind of threw me off.
Well, I was trying to decide you or Georgia, and I went with you, but you're, by right, recognized to have 5 minutes.
Thanks, sir. And I move to strike the last word. I just think it's interesting that so many of my Democratic colleagues are opposing a federal program for substance abuse while they supported President Biden's wide-open border that allowed fentanyl to flow across our borders in unprecedented amounts, killing over 100,000 Americans. I also think it's interesting that they would use the terminology of whistling past the graveyard when there are American citizens buried in graveyards all across the country. Lincoln Riley, Ruby Garcia, Rachel Morin, I could go on, that were killed by people who crossed our borders illegally. I've not heard a single Democratic member of this committee acknowledge the success of President Trump in securing our border and interdicting illegal drugs. I think it's interesting, Mr. Chairman, that we're having this discussion about a program that they supported just a few months ago. It's also interesting that they keep raising this issue of tax cuts for billionaires. Mr. Chairman, you have any idea how many billionaires there are in the United States at any given time? It's somewhere between 750 and 800. In the last election, there were 135 billionaires that were actively engaged in the election. 82 of those supported the Democratic candidate Kamala Harris, that'd be 62.8%. 53 supported President Trump. So I would think if you want to look at it proportionally, it's the Democratic Party that has a billionaire problem, not the Republicans. I yield back.
Gentleman yields back. Now recognize Ms. Matsui.
Thank you very much, Mr. Chairman, for yielding. I move to strike the last word in support of the Castor Amendment, the whistling past the graveyard amendment. The Support Act reauthorizes critical programs at HRSA, SAMHSA, and CDC to address the opioid overdose epidemic. While it would have been better if support was already signed into law, as it could have been, as part of the end-of-the-year package, it's timely we're discussing it right now. Last month, Secretary Kennedy renewed the declaration of a nationwide public health emergency due to the opioid crisis. Yet, at the very same time, Kennedy and the Trump administration are actively attacking and dismantling the federal health infrastructure, the very infrastructure we need to fight the opioid crisis and implement the programs in this bill. Earlier this month, HHS announced drastic restructuring, including massive personnel cuts, the consolidation of 28 divisions into 15, and the closing of 5 regional offices. Secretary Kennedy announced that 10,000 full-time employees would be terminated. This is on top of around 10,000 jobs already eliminated. In total, almost a quarter of HHS has been indiscriminately fired. Some employees only learned their jobs were terminated when they tried to use their badges to access their workplace. Shameful. Is this how we treat civil servants dedicated to public service? As members of Congress, we should be receiving briefings on such an extreme overhaul of agencies in our jurisdiction, yet there is little to no transparency from the administration on which employees these layoffs affect. In the one briefing HHS offered to our staff, they said the RIF impacted personnel, not programs, and all critical programs would continue. But how can that be true when at SAMHSA, directors of the Center for Mental Health Services, Center for Substance Abuse Prevention, and Substance Use Treatment were terminated? Entire offices were eliminated. How is SAMHSA to carry out its essential work to improve substance use disorder and mental health treatment services, including implementing the programs in this bill, when it is in a tailspin due to losing key leadership? To top this off, the administration's leaked HHS budget has given us a window into their thinking, and it seems their slash and burn strategy is not limited to personnel after all. Their wish includes entirely eliminating multiple Support Act programs, including youth prevention and recovery, first responder training, comprehensive opioid recovery centers, and residential treatment for pregnant and postpartum women. Mr. Chairman, Mr. Guthrie, as this is your bill, I hope your office has had better luck contacting the administration to find out who will be around to implement the Support Act and whether HHS plans to ignore Congress's direction to carry on these programs. So I can't pretend we are in the same place we were last year. It's hard to understand why we are even discussing the Support Act when the administration is planning to eliminate multiple programs that this bill seeks to reauthorize. As members of Congress, especially on E&C, we need to have oversight over the programs we all care about. We need to know the impacts of these reckless and aggressive cuts. That's why I support this amendment, and I urge my colleagues to do the same. With that, I yield the balance of my time.
Gentlelady yields. Now recognize the gentleman from Georgia for 5 minutes.
Mr. Chairman, I rise once again in opposition to this amendment. Just like all the other amendments, this amendment would unnecessarily delay the implementation of this critical bill. A critical bill that we all agree needs to be done, needs to be passed. It's my understanding, again, that none of the programs outlined in the amendment have been impacted by the HHS reduction in force. Yet this amendment would simply result in delaying the allocation of important resources for prevention, treatment, and recovery for individuals suffering from substance use disorder. These patients deserve our help, and getting the Support for Patients and Communities Reauthorization Act signed into law is one way we can fully assist these individuals and families. I urge my colleagues to oppose this amendment, and I want to yield right now to the gentleman from Alabama, Mr. Palmer.
I thank the gentleman for yielding. Mr. Chairman, I just want to point out that SAMHSA is not being eliminated. It's being merged into a newly formed administration for a healthy America. This is part of the Trump administration's efforts to make government more transparent, more effective in meeting the needs of the American public. and less costly. So I keep hearing my Democratic colleagues say that this program, this agency is being eliminated, when the fact of the matter is it's being merged into a new administration for a healthy America. Mr. Chairman, I would like to enter into the record an article from Behavioral Health that makes that point, that it's being merged into a new administration.
Without objection, gentleman.
I yield back to the
ranking
gentleman from
member.
Georgia.
And I yield.
Oh, without objection, that is entered into the record and now recognize the gentlemen have yielded back and now recognize the ranking member for his 5 minutes.
Mr. Chairman, I just want to ask unanimous consent also to enter into the record 3 documents, which I mentioned before, but they all point out, well, let me start with that. Is there an objection?
Well, tell us what they are.
We mentioned it already. These are all documents that talk about the extent of Trump's and DOJ's cuts to HHS in terms of both the amount of money, in terms of the staff.
And I see that one of them is from Politico and one, what are the other 2?
Politico, what is this? Washington Post and, what's this? I think this one is from, I don't know what publication it is. You could look at it before and decide, but I'd like to enter them into.
Without objection? Hearing none, they're submitted for the record.
Thank you. But what I was trying to point out in response here is that it's clear that HHS is making major cuts in funding, not only in terms of what Mr. Tonko mentioned before, in terms of money that's going to the states that was obligated in block grants, but also in the various programs in SAMHSA. And while the gentleman is saying that SAMHSA is, being, put in a different area of HHS, the bottom line is that many of these programs are being eliminated completely. Regardless of how SAMHSA is being reorganized, many of the programs are completely eliminated. And the level of cuts is about $40 billion, 1/3 of the department's discretionary budget. And that includes a significant number of cuts in SAMHSA and overdose treatment and substance abuse treatment programs. And again, as I pointed out in my opening remarks, there's nothing in here that suggests that somehow this reorganization is going to, end up with more treatment. I mean, less money, less people, less treatment. And the secretary who's doing most of the speaking here doesn't suggest in any way a rational basis for all this, or suggest in any way that that the result of these changes, a reorganization, is going to mean a better program or one that helps people reduce overdoses or reduce dependence on drugs. I wouldn't argue that it's important to stop the flow of drugs into the country, but that's not what we're discussing today. We're discussing what's within our jurisdiction, which is SAMHSA, treatment programs, educational programs, ways of helping people that are using drugs. I mean, it's certainly better if the drugs aren't available, but as you know, the drugs continue to be available, with whatever means. People get them. So to me, this idea that you would oppose an amendment by Ms. Castor that requires the Secretary to halt all efforts to eliminate programs reauthorized by the Support Act, your opposition doesn't make any sense. All we're really saying here is that these cuts, these layoffs, all these things should cease. And if they don't, there really isn't any point in our reauthorizing this bill. What's the point? The Secretary continues to make the cuts, the money doesn't flow to the states, and the people suffer, or as Ms. Castro said, people die. I mean, we really are talking about people who are going to die here because of these cuts. But with that, I yield back, Mr. Chairman.
Gentleman yields back. Do I have anybody else on the Republican side that wishes to speak? Seeing none, recognize the The gentleman from New Jersey, Mr. Menendez.
Thank you. I just want to quickly respond to the comment that my colleague from Alabama mentioned about an administration's impact on the health and specifically the mental health of Americans. And this is, again, the silence of Republicans, because imagine the mental health of parents who send their children to a Head Start program who hear the president's thinking about cutting that program. Imagine the mental health of federal judges who are constantly attacked by this administration because they disagree with a court's ruling. Imagine the mental health of federal employees who one day told they are being let go, who then are rehired, who have no certainty, and many of whom live in our districts. Imagine the mental health of Ukrainians here under U4U or TPS who were sent an email saying that they were going to have to self-deport, and then the administration admitted that email was sent by accident. Every single day, this administration is causing immense harm to all of our constituents, not just those that Democrats represent, but all of our constituents. And that's why the Republican silence with respect to the harm that this administration is causing is so difficult for us to comprehend. So we should speak out when an administration is hurting our constituents. We should speak out when they're impacting their mental health. But it seems to me that you all will be silent in this moment. And that's just what frustrates so many of us, not just here, but throughout the country. With that, I yield back.
Gentleman yields back. Any further?
May I respond?
You need to get somebody to ask for time and yield to you. Gentleman from, where are you from? Florida, South Carolina.
Oh, my goodness.
Sorry. I'll never
I
give you
get
his
extra
vote
minutes
again.
for that one. I yield to the gentleman from Alabama.
I think that my colleagues on the Republican side and I have great compassion for people and their mental health. What I don't understand is my Democratic colleagues' idea that there's not a single federal employee that doesn't need to be employed. I mean, I was laid off 3 times. The last time I had $500 in the bank. I understand that, and I understand what people are going through. But I also think that we've got $37 trillion in debt, and what a crushing blow that's going to be to future generations of Americans when that comes due. You want to talk about a mental health crisis, you'll have one then. The other thing is I think it's patently unfair to attack us on our motives. We're trying to do what's best for the country. We're trying to make some difficult but necessary decisions. I mean, I've sat here the entire hearing, listened to my Democratic colleagues talk about that we're eliminating SAMHSA when that's just not true. It's been, there's a reorganization taking place, enrolling a lot of these agencies into one administration within the Department of Health and Human Services. I just think when you talk about mental health issues, you need to think about some of the people who lost loved ones to drug overdoses as a result of the border not being secured, being left wide open. The number of families who lost loved ones murdered or killed by a drunk driver, by someone who's here illegally because the border was left wide open. I just think that we need to stick to facts. We need to focus on these things together. I really do think that we're facing a fiscal crisis in the country. You keep talking about tax cuts for billionaires. That's a total misrepresentation of what's going on here. We're trying to get our fiscal house in order. We're focused on the future of the country, what's best for our children and grandchildren. So, I mean, you can continue this type dialogue if you want to, and it's not going to get us anywhere. It's going to make things harder, make it harder for us to get things done, the things we need to get done. I mean, we could go back and talk about the mental health of President Biden, his mental acuity. I think in some respects that's unfair. That's what's in the past. I think he was mistreated by his own party. But let's focus on what we need to do. Let's quit exaggerating things, and try to get some things done that matter for the American people. I yield back to the gentleman from South Carolina. Thank you for yielding.
I yield back to the chairman from New Mexico.
Fair point. Gentleman yields back and recognize the gentlelady from California for 5 minutes.
Thank you, Mr. Chairman. I wasn't going to speak, but I feel compelled to say something responsive to what my colleague just talked about, because the hypocrisy is just hard to just sit and listen to without saying anything. My colleague wants to talk about fiscal responsibility and the debt. Yet, under this president, under this administration with House Republicans, they are the ones who helped blow up the debt. And they want to do it again. They're looking to add trillions and trillions of dollars to the debt. Don't take my word for it. Just go look at the clip that Senator Rand Paul had on the Senate floor the other day. So don't come and lecture us about the debt when that is exactly what you are doing. And two, why? Why are you doing it? Who are you going to help? It's not people who need mental health services. It's billionaire donors. Oh, and my colleague made a comment how Democrats have a problem with billionaires. I will just remind the American people, Elon Musk spent almost $250 million to elect this president. And what did he get in return? He's gotten complete control over the White House, over cutting programs. Even House Republicans have yielded their power, have yielded their oversight power on the billionaire, Elon Musk. So don't tell us we have the problem. The problem, and the American people see it, is House Republicans bending the knee. It's House Republicans giving in and saying, we're gonna let this billionaire do whatever he wants. I've been to town halls in my district. I've been to town halls in Republican districts, and this is a concern of the American people. And don't be gaslighted when Republicans say they're not giving tax cuts to the billionaires, because that's exactly what is happening. It's in writing. These proposals are out there. And the next week in this committee, we're going to have a hearing on where we're going to find $880 billion to cut. Why? So they could give tax cuts to their billionaire friends. And what do you have to touch to get there? The math tells you you've got to touch Medicaid. You've got to touch health care for people that are disabled, people that need it, and many of these people are already working. You've got to do it. So I'm looking forward to having this conversation, but this is really corruption at its finest in government right now, in selling basically power away to a billionaire who has a seat at the cabinet meeting tables when he's not even a cabinet member, who won't come into the Congress to be held accountable. As a matter of fact, there is no oversight. Every day we see House Republicans not lowering to bring costs down, which is exactly what the American people thought they were going to get, but prices are going up. And House Republicans in the Congress, what are they doing? They're passing rules so we can't have any oversight, so we can't have any inquiries. So don't be fooled by the rhetoric. Go look at the actions. Go look at the actions. And with that said, there should be an investment in mental health services. Okay, my colleague also wants to talk about immigration. Let's talk about that just for a second. US citizens are being deported from this country. You don't think that the American people, even US citizens, are having mental health impacts on what is happening in this country right now? US citizens. So don't come and lecture us about mental health when you are standing silently, saying nothing, doing nothing, because you're too afraid, and because a billionaire is making these calls and you're okay with that. And you're saying, well, this guy's rich, so he must know what he's doing. And nobody thinks that one federal worker shouldn't be laid off. That is a total lie, like total misrepresentation. That's not what they're doing. This was a sledgehammer approach, saying, we're just going to cut all these employees. We're not going to do any review. We're not going to look at any programs. We're just going to take the sledgehammer approach. And with that said, I yield back.
Gentlelady yields back. Is anybody on the Republican side that wishes to speak? Seeing none, is there anyone else? Ms. McClellan of Virginia.
Thank you, Mr. Chair. I just want to also comment on this notion that Democrats don't want layoffs. What we don't want is for the administration to put in the hands of an unvetted billionaire with no federal government experience, hiring a group of people with no federal government experience who have no idea what the agencies do where they're instituting mass layoffs, to go in and give people 15 minutes notice that they're being fired. Fire by accident the workforce that prevents the spread of Ebola, and then laugh about it in a cabinet meeting and say, oops, mistakes were made. The private sector doesn't operate like that. No other institution treats people like that. They go through and figure out agency by agency or department by department what functions are essential and which ones are not. None of that happened here. And all of these firings impact our state and local partners. In Virginia, the firings at HHS, over a fourth of its workforce, trickled down and impacted firings at our Department of Health, our local departments of health, putting programs that keep people in rural Virginia, urban Virginia, and everywhere in between healthy and safe at risk. They happen at the same time that the administration illegally dismantles the Department of Education and says, well, the functions that they do dealing with students with disabilities or providing services to at-risk students will just be done by the Department of HHS, which has no expertise or training or experience dealing with children with disabilities. And who's going to do it when a fourth of their workforce is being fired? It is the haphazard, cavalier, in some cases downright cruel way that our federal employees first were traumatized, which is what Russell Vought said he wanted to do, and he's done it. They've been traumatized, dehumanized, thrown away like trash, with no regard, not only for the impact on them and their families, but the impact on the critical services like addressing substance abuse disorders that we're trying to address. And I won't speak on the whole, I won't speak for the whole Democratic Party, but what I want to see is some compassion, some thought, some foresight, and some honesty about what Doge and Elon Musk and one of the least qualified Secretary of Health and Human Services I've ever seen in my lifetime are doing, not just to our workforce, but to the vital services the American people want us to provide as a federal government to keep them alive. That's what we want to see. And to say, well, we're doing this because we have to get the debt under control. It was the first Trump administration that blew a hole in the debt, adding over $8 trillion to it. And it was your side of the aisle that voted for a budget plan that would increase the debt even more. So let's talk about what's really happening, and let's try to throw a little bit of compassion in as we try to figure out how to keep Americans safe. Thank you.
Gentlelady yields back. Any further speakers? Seeing none, let's move to a vote on the amendment. And we have a roll call requested.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Mrs. Lee. Mrs. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Evans. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana.
Aye.
Mr. Carter of Louisiana votes aye. Mr. Menendez.
Aye.
Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Crenshaw votes no. Dr. Dunn is not recorded. Dr. Dunn votes no. Mr. Obernolte votes no.
Seeing no other present for the roll call, the clerk will report.
Chairman Guthrie, on that vote, there were 24 ayes and 27 noes.
The amendment is not agreed to. Are there further amendments? The gentlelady from Texas, Ms. Fletcher, for what purpose do you seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk will report.
Mr. Chairman, could the gentlelady please specify her amendment?
Yes, I have an amendment specified H 2483 AMD_01_XML.
And if I could reserve a point of order, Mr. Chairman.
Order is observed by the gentleman from Virginia. Clerk will report.
Amendment to the amendment in the nature of a substitute to H.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Texas is recognized for 5 minutes in support of the amendment.
Well, thank you, Mr. Chairman. I have this important amendment on an issue that's squarely before this committee today, and that will be again and again. But before I get into that amendment, I do want to associate myself with the comments from Ranking Member Pallone and Oversight Ranking Member Clark, because we cannot remove the work that this committee is doing from the context that we are doing it in, which is what my colleagues on the other side of the aisle keep suggesting we do today. This isn't bickering, as Mr. Obernolte suggested. It is objecting. It is objecting to using this committee and this Congress in a charade that obscures what the Trump administration is doing, what it is actually doing. Cutting the programs that we're authorizing and cutting the funding that we're appropriating to make them possible. And on this bill, for example, we just heard from Representative Castor. We know that the White House Office of Management and Budget has shared its budget proposal eliminating the Support Act programs that we're here talking about reauthorizing. And so, you know, it's really important that we understand the bigger context in which this is happening. And these cuts are continuing, and that's what my amendment is about. My amendment is about cuts to Medicaid, and more than 70 million people in every state in this country rely on Medicaid to receive the health care they need, including mental health care. In my home state of Texas, Medicaid provides health care to more than 3.8 million people, and Texas has very narrow eligibility for Medicaid coverage. Adults under 65 who are not disabled or raising a child are ineligible for Medicaid, no matter how much they make, no matter how low their income is. And those that do qualify, the formula is based on the federal poverty level, as we all know. And as a reminder, what is the federal poverty level? This year, for a single person, it is income of $15,650 a year. For a family of four, it's $32,150. So many people in Texas don't even qualify for Medicaid. But for the people who do, it is children, adults with disabilities, people living in nursing homes, and moms who've just given birth. And I should add, as we look ahead to the proposals we anticipate coming to this committee, 57% of the adults in Texas, of those adults I just identified, who receive Medicaid are working. Despite Texas's narrow limits, in my district, more than 85,000 of my constituents rely on Medicaid, and more than 60,000 of them are children. And I've looked at the most recent tables. I'm sorry that many of my Republican colleagues from Texas are not in here to hear this, but most of my Republican colleagues on this committee from Texas have more constituents relying on Medicaid in their districts than I do. And of course, Mr. Chairman, I looked at Kentucky's 2nd District, and as I'm sure you know, there are more than 211,000 people in that district relying on Medicaid. This matters. This matters to the people who are relying on Medicaid for their critical health care, including their mental health care. It matters to the people that we are here to represent. They are relying on Medicaid for access to treatments, for access to the devices and the care that we spend so much time on this committee working on, trying to enable, trying to make possible. And there is just no way that you can cut billions of dollars from Medicaid without hurting all of our constituents. And you don't have to just take my word for it. The CBO said so on March 5th. I have the letter from the CBO here responding to a request from Ranking Member Pallone and Mr. Boyle. I would like to submit it for the record. This says that you cannot cut from the budget from our committee without cutting Medicaid. I'd like to submit that for the record, Mr. Chairman.
Without objection, so ordered.
Thank you. It's just, there is not a single congressional district that's going to come out unscathed from cuts to Medicaid. Our constituents depend on us to stand up for them in this room and in this body. So I have an amendment at the desk in this markup to ensure that we do that by preventing the Department of Health and Human Services from taking actions that would reduce eligibility, reduce enrollment, reduce covered benefits, increase cost sharing, or reduce federal funding for medical assistance for people eligible for Medicaid or CHIP. Simply put, it prohibits the administration from making cuts to the Medicaid program. And I hope that my colleagues on both sides of the aisle understand the damage this is going to do to all of our constituents, to people across this country, and to the work that we have been doing on this committee to help people get access to the health care, the treatments that they need, including mental health care. So I hope that everyone on this committee can come together to protect the people we represent. And with that, I'll
Would that gentlewoman yield to me? Would the gentleman?
yes.
You mentioned, the gentlewoman mentioned the OMB budget that proposes to cut 8 of the Support Act programs, and I'd like to submit that for the record, Mr. Chairman, if I could.
The budget? Without objection, so ordered.
Thank you. I yield back to the gentlewoman.
Thank you, and I yield back, Mr. Chairman.
Gentlelady yields back. The gentleman from Pennsylvania, Dr. Joyce, is recognized for 5 minutes on the amendment.
Mr. Chairman, I move to strike the last word.
Gentleman's recognized.
Mr. Chairman, I speak in opposition to the amendment. And while I appreciate my colleagues' interest in supporting individuals with substance use disorder and mental health conditions, this amendment is unnecessary. The Support Act that we are considering today proposes no changes to Medicaid. As evidenced by the bill under consideration today, Republicans have made it clear that this committee will continue to focus on substance use disorder. This work will build on the inroads Congress made last year, which includes reforms to lift the IMD exclusion for substance use disorder treatment in Medicaid and to expand access to Medicaid's coverage of addiction treatments, including policies to suspend coverage for beneficiaries while they're incarcerated so that the coverage can resume immediately upon their re-entry into the community. We have made it clear that we want Medicaid programs to focus on the most vulnerable populations among us, including those with substance use disorders. Again, I will note that today's bill does not make any changes to Medicaid, and this amendment is unnecessary. I yield back.
The gentleman yields back. The ranking member wants his own time, so I will yield to the ranking member.
Thank you, Mr. Chairman. A lot of discussion in the context of this amendment about Medicaid, and it's been reported, Mr. Chairman, that next week we're going to consider, and I don't know that it's been officially noticed, but it's been reported that next week we'll consider the majority's reconciliation bill in the Energy and Commerce Committee, which has been instructed to cut at least $880 billion in federal funding. And the Congressional Budget Office has made clear there's no way to get to this number without hundreds of billions of dollars in devastating cuts to Medicaid. This is what Ms. Fletcher said. But the problem that I have is that House Republicans continue to claim that there will not be cuts to Medicaid or that these cuts won't result in people, including their own constituents, losing benefits. The Speaker has essentially said that, and so has President Trump, and even a lot of members of Congress on the Republican side. So, Chairman, you said in the press, and I quote, that there is an opportunity to not take away any benefits, unquote. So I wanted to ask you, does this mean that the reconciliation bill, which is likely going to be released next week, will not cut benefits for the working class Americans who rely on Medicaid for their health care? Are you basically taking the position that we're not going to cut Medicaid benefits? That's my question.
Well, we are still working as a committee, as on the Republican side, on what a reconciliation bill, working with other members of the House and in the White House. And we are set, if you know, Medicaid is scheduled to grow from about a $700 billion program to a $1 trillion program. And we believe there's opportunity in the growth to Medicaid, but I will tell you, we'll still spend more money each and every year on Medicaid over the next 10 years.
Well, you know, I do appreciate your honesty, I think, in that you have suggested that there may be Medicaid cuts. And so I appreciate you being honest in saying that, although obviously I oppose the Medicaid cuts, but at least you're suggesting that there may be, and being honest about it. I don't know what the Speaker or the President are doing because they're suggesting otherwise. But given the breadth of the cuts anticipated by this committee that I think will happen to Medicaid, when do you expect we'll actually see the text of the bill? Will the Democrats and the American public be afforded only the 36 hours prior to the markup, or are we going to have more time? When will we get this text?
I don't believe that I've ever used the word cut. I do say that there's an opportunity to restrain the growth and modernize the program. We are still working through. We will obviously meet the notice requirements of the committee, and we'll look forward to hopefully getting to the point we're ready to go forward.
Well, I would hope that we get more than the 36 hours. I know that that's all that's required, but I think given the magnitude of this, however you describe it as cuts or not cuts, we should be able to see the text more than 36 hours. So I would ask that that be the case. We'll see. You know, I expect this bill is going to cut people off their health coverage, decimate the benefits they receive, balloon Americans' out-of-pocket costs of medical debt, and slash payments to an already strapped Medicaid provider program and gut access to care. And so I do want to stress that however you call it, the bottom line is that we're going to see cuts to Medicaid and people thrown off their health care coverage. And so I think it's important that this document get out well before the committee reconciliation markup. I know some members had suggested that next week would be a hearing, but I want everyone to understand there's not a hearing. This is going straight to markup. And so there's not going to be a hearing. All the more reason why I think we should get the bill well before the 36 hours. And the bottom line is that all this is being done, all these cuts are being proposed just to pay for tax cuts for billionaires and large corporations. That's what it's all about. But in any case, Mr. Chairman, I yield back.
The gentleman yields back. The chair needs Republican members seeking recognition. Gentleman from Florida, Mr. Soto, is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I rise to oppose cuts to CHIP. Kid Care is what's known in Florida. About 50% of kids under 6 years old in my district are on this program. It's been 100 days since President Trump took office as of today. And I know what you're thinking, it's felt like a year. He's garnered the lowest approval rating of any president in 80 years, which is not a surprise because he wrecked a good economy in 100 days. And the reasons are obvious. International trade and tourism, critical to places like Central Florida, are in decline because he's attacking our allies. His tariffs are causing costs to rise. Unemployment is up. Retirement plans are down. And some of our workforce is being deported. In Florida, about a third of our workforce are immigrants in tourism, agriculture, construction, and service industry. And Trump is barreling us towards a recession, the most avoidable recession in my lifetime. Back home in the district for the last 2 weeks, I heard from small businesses who are seeing less customers, manufacturers and theme parks who are seeing their workers deported, and hotels with bookings dropping like a rock. It's no wonder a majority of Americans have already lost faith in President Trump in record time. Now add in your proposal to cut Medicaid by $880 billion. That markup's coming next week. Massive cuts to kid care, massive cuts to nursing home care. That'll mean $4 billion for Florida's Medicaid program next year. That's about a 10% cut to the program, kicking off seniors and nursing home seniors and kids during what could potentially be a recession. You'll see kids get kicked off kid care. You know, I visited our state capitol last week, and they are dumbfounded about the prospect of having to cut that much from the state budget. And for what? For tax cuts for billionaires and a $20 trillion addition to the national debt? And if there is a recession, God forbid, that'll leave us broke and unable to be able to handle it to get us out of it. All this considered, I'm supporting this amendment because this gives us an opportunity to all say no. We're not going to cut kid care. We're not going to cut nursing home care for seniors. We're not going to do this for billionaire tax cuts and a massive increase in the national debt. And this amendment gives you the opportunity to stop these Medicaid cuts too. And I yield back.
The gentleman yields. For what purposes the gentlewoman from Virginia wish to be recognized?
Thank you, Mr. Chair. While this bill may not include cuts to Medicaid, as Mr. Pallone, Ranking Member Pallone has pointed out, the math doesn't work for this committee to reach the $880 billion that it has been told to cut.